The case of Adriana Smith, currently unfolding in Atlanta, is sparking intense ethical debate across the country. Adriana Smith, a 30-year-old nurse, suffered severe headaches in February, which eventually led to her being diagnosed with multiple brain blood clots and ultimately declared brain dead at Emory University Hospital Midtown, where she once worked. Remarkably, she was just 9 weeks pregnant at the time of her brain death. For over 90 days, she has been kept on life support, her pregnancy now advanced to 22 weeks. This scenario, preserving a deceased woman's body to nurture a developing fetus, raises profound ethical questions and exposes gaps and confusions in both medical practice and law. Georgia's strict abortion law, the so-called Heartbeat Bill or the Life Act, classifies a fetus as a person after a heartbeat is detected, which can be as early as 6 weeks. Under this law, other medical options for Adriana or her family were reportedly not considered. Her mother has publicly stated that doctors intended to keep Adriana on life support until at least 32 weeks of gestation so that the fetus could have a reasonable chance of survival. Media reports highlight that options were limited by Georgia's restrictive legal environment, emphasizing the complex interplay between medicine, ethics, and politics in this tragic case. But key uncertainties remain. Was Adriana given all possible care at the right times? Was her medical treatment appropriate, or were mistakes made? Who truly spoke for her wishes and values once she was no longer able to decide for herself? These questions are clouded by sparse facts and rumors, with little clarity about crucial conversations among her family, doctors, lawyers, or possibly an ethics committee. What's clear is that the situation highlights deep misunderstandings around patient rights and medical ethics. The first major ethical issue is the right of a competent patient, or their chosen surrogate if they are incapacitated, to refuse medical treatment, regardless of the impact on others. Ethically and legally, that right stands even if it results in life or death for someone else. In Adriana's case, no one seems to know what her preferences would have been. But a general ethical and legal presumption exists: people, or their surrogates, can refuse life-sustaining treatment posthumously. Second, removing life support from a brain-dead individual carrying a fetus should not be labeled as abortion. The intent in such cases is not to terminate the pregnancy, but to acknowledge biological reality after death. The ensuing end to fetal development is a consequence of death management, rather than an act of abortion under ethical definitions. Most critically, attempting to sustain a pregnancy in a deceased woman for months, with the goal of eventually delivering the baby by C-section, is not established medical practice, but highly experimental. There is virtually no scientific precedent for this kind of extended, technology-supported incubation, and the outcome for the fetus in such cases is deeply uncertain, both in terms of survival and long-term health. No established obligation exists for physicians, legal authorities, or families to engage in such medical experimentation, especially without explicit prior consent. Ultimately, the Adriana Smith case is a tragedy compounded by medical ambiguities, intense political pressures, and deep uncertainty about patient rights. It starkly reveals that using a person's body posthumously as an incubator is not a routine therapy but an experiment, one for which there is no ethical or legal requirement to participate. It's a case demanding careful reflection, clearer communication, and, above all, respect for patient autonomy even amid uncertainty and emotional turmoil.